Ecg Interpretation. Step 1. Determine the heart rate. Count the number of QRS complexes in a 6-second strip. Multiply the number of QRS complexes by 10 to get the heart rate in beats per minute, BPM. Step 2. Identify the rhythm. Look for P waves, QRS complexes, and T waves. Determine if the rhythm is regular or irregular. Check for any arrhythmias, such as atrial fibrillation or ventricular tachycardia. Step 3. Measure the intervals. Measure the PR interval, from the beginning of the P wave to the beginning of the QRS complex. Measure the QRS duration, from the beginning to the end of the QRS complex. Measure the QT interval, from the beginning of the QRS complex to the end of the T wave. Step 4. Analyze the waveforms. Look for any abnormalities in the P wave, QRS complex, and T wave. Check for any signs of ischemia, infarction, or hypertrophy. Step 5. Consider the clinical context. Consider the patient's medical history, symptoms, and physical examination findings. Correlate the ECG findings with the clinical presentation. Normal ECG values. Heart rate, 60 to 100 BPM. PR interval, 120 to 200 milliseconds. QRS duration, 80 to 100 milliseconds. QT interval, 300 to 440 milliseconds. Common ECG abnormalities. Arrhythmias, e.g., atrial fibrillation, ventricular tachycardia. Conduction disorders, e.g., first-degree AV block, bundle branch block. Ischemia or infarction, e.g., ST segment elevation, Q wave formation. Hypertrophy, e.g., left ventricular hypertrophy.